Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Aina. So today our group member will present about X-ray. So the introduction is X-ray are high energy electromagnetic wave with small wavelength that can pass through many material. X-ray are electromagnetic waves that have wavelength varying between 0.01 and 10 nanometers. This means that the frequency and energy of these waves are high. In fact, they are high enough for X-ray radiation to be a type of ionization radiation. So the application of X-ray is X-ray imaging. This imaging technique uses a small amount of controlled radiation to produce image of the human body interior. Because various organs absorb radiation differently, images reveal different areas of our body in either black or white. X-ray imaging have application in medical. For example, X-ray imaging is used for a variety of purposes, such as getting an image of broken bone, swollen objects, and lung infection. Another common use of X-ray imaging is to scan passenger or luggage at airport and mall. When used for luggage, the machine has a detector that detects the X-ray after they pass through the object. The X-rays are then sent through a filter which filters out the lower energy X-ray, while the high energy X-rays are detected by a second detector. A computer compares the data yielded by the two detectors to better depict low energy items such as biological items. Since different objects absorb different amount of X-ray, this difference can be seen on the screen used by the operator. There are three primary categories depending on the spectrum of energy that pass through the object, like organic, inorganic, and metal. The application of X-ray is in industrial. For example, X-ray can detect the crack in piping. X-ray pass more easily through such imperfection, which means that weak area will show up on photograph you can take with a specialized radiography camera.
Hi, my name is Patricia Adriana and my metric number is A1846. So I will tell you how do X-ray works. Atoms, molecules, and nuclei are made up of photons and electrons. When a negatively charged electrode is heated by electricity, electrons are liberated, creating energy. This energy is then converted into an X-ray. High-velocity beams of that energy are directed towards a metal plate or anode where they clash with the atoms to create an X-ray. A detector on the other side of the body picks up the X-ray after they have passed through and turns them into image.
Hi, my name is Ratu Shifa. In my part, I will present about the advantages and disadvantages of X-ray. First, we go through to what is the advantages of X-ray. X-ray can be beneficial for help to diagnose tumor easily without the need of surgery. Second, it has lower radiation compared to CT scan. Third, X-rays are widely used by radiologists to identify cracks for infections, to identify level of injury, and to identify abnormal bones. Lastly, we go through to the disadvantages of X-ray. Due to its radiation, it mutates cell which causes ionization. This often leads to cancer. It does not provide 3D information. Lastly, it does not produce the best image but medium quality of image. So that's all from me. Discover what are the advantages and disadvantages of X-ray. Thank you.
Hi everyone, my name is Nofazina Shukri. My metric number is A1959. Right now, I'm going to discuss with all of you guys about the improvement that can be done on X-ray, which is by reducing dosage and enhance image sharpness and contrast. So the first one is reducing dosage. It is important to keep the dosage minimum because it can lead to growth of cancerous tissues. Before this, patients had to be exposed to long and intense doses of X-ray due to its quickly absorbed by photographic films. But nowadays, radiographers use image intensifiers. Based on the pictures, it shows that incoming X-rays strike a phosphor screen, producing visible light photons, then release the electron by the photoelectric effects. The electron is radiated and focused by the positively charged anode, strike the screen and gives out visible light. The image can be viewed and stored. Using an image intensifier reduces the patient exposure by factors of 100 to 500. The second one is enhanced image sharpness and contrast that include 2 points, which is contrast techniques and contrast media. On contrast technique, it's separated by 4 different layers that work together to bring out most benefit. It started with aluminium that mainly for reduce the numbers of low energy X-rays. Collimators were used to limiting a beam of X-ray and gamma rays. At the same time, it pleads stopping a gamma rays and X-rays. On the last layers, film cassette contain film and fluorescent material which can emit light, hence the X-ray visible for observation. Last but not least, contrast media was used to increase image contrast on the area where the tissue is a poor absorber. Picture shown is one of the example which patient with stomach disorder drink barium sulfate, or we call it as barium meal, which coats the lining of the stomach and makes its outline very clear on the image. Based on the interesting pictures of patient taking barium meal, a large pale area show where the barium has accumulated. On the other hand, iodine also can be used to produce clear image of the cardiovascular systems. That's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Ali binti Mazaki and my membership number is A1943. So I will talk about conclusion of our group assignment, which is topic X-ray. So first, we must have a basic knowledge of radiation physics and safety help in evaluating some of the limitation of X-ray investigation, like how my friends before explained about the X-ray. So actually, X-ray examination is painless and the procedure is not invasive. So X-ray are safe when we use it correctly. This is because specialists, radiologists, and X-ray technicians have been trained to manipulate the minimum amount of radiation required with optimal results. Therefore, radiation dose is often measured using an effective dose quantity expressed in millisievert, which is MSV. This is because different type of reaction X-ray examination carry different amount of radiation. Although most studies have shown that the risk of X-ray examination is very small, so it will be a question of how to reduce the risk. So actually, it depends on the medical needs and alternative to this X-ray examination. So in conclusion, the science of radiography deals with understanding and overcoming some of these difficulties in the most effective way. So that's all from me. Thank you.